Thank you so much, Tiffany. Hello, everyone, and welcome. My name is Monica Porter. I'm joined by my colleague, Nora Breslin, and we are here from Homebase to provide you with some information about the census today. We wanted to just take a moment to say hello from our remote locations. We're going to go ahead and turn our videos off now so that the focus can be on our slides. Thank you so much to CPCA for organizing this webinar, and thanks to everyone for watching a recording, for taking time out of your busy schedule to join us. As I said, my name is Monica Porter, and I'm joined by my colleague, Nora Breslin. We're both attorneys at Homebase, and we're delighted to share with you today some key information about how you can help ensure that people experiencing homelessness are effectively counted in the 2020 census. Homebase is a nonprofit that supports communities across the state in their efforts to end homelessness. This year, Homebase is working with California Complete Count to educate homeless systems of care about the census and how people experiencing homelessness can be effectively counted. We have a lot to cover today. First, I'll cover some information about Census 2020, ensuring a complete count of people experiencing homelessness, some information about census incentive grants to encourage people experiencing homelessness to participate in the census, and of course some additional considerations regarding COVID-19. Then Nora will cover effective communication to ensure people experiencing homelessness are counted. She'll talk about cultural competency and humility, information to communicate, and ensuring access across languages and abilities. A brief note on language today. We will use the terms people experiencing homelessness and people who are unhoused interchangeably. Also, we want to note that today's webinar is being recorded on Thursday, March 26, 2020. We want to pause to acknowledge the ongoing COVID-19 pandemic and that things are in an uncertain place right now. The information we are covering is current as of today, March 26th. Some information we discuss today, such as dates, may be subject to change. In addition to sharing our slides, we will share handouts and contact information if you have any questions. And we'll save some time at the end of today's presentation to address any questions that might come up with our live attendees. Every 10 years, the census is required to count every single person in the United States. We want to acknowledge at this time that there's a lot of stress and uncertainty related to COVID-19, and the census is understandably not at the top of a lot of folks' priority lists. That's why we're counting on you as trusted members in your community to get the word out on how very important the census is. Data gathered from the census is used to determine the distribution of billions of dollars in funding each year. Census data determines how much funding communities get for affordable housing, food assistance programs, shelters, and many other homeless services. This data is also used to reapportion the House of Representatives, and especially at this time when we're really counting on the federal government to provide crucial support and resources, we cannot afford to lose advocates representing us and our communities, especially people experiencing homelessness. The census is very residence-based, so people without housing or an address are at risk of not being counted by the census. It is vital that people without housing are counted to ensure that there are enough resources for housing and homeless services in each community. With the spread of COVID-19, it is more important than ever for trusted messengers, such as healthcare providers, to share all of the ways that people who are unhoused can respond to the census. And we'll go over each of those in today's presentation. As healthcare providers, you already have a relationship of trust with your clients and patients and can help to convey key information about the census. First, the census is safe. There is no citizenship question on the census. The census also cannot share any information with any government agency, including law enforcement and ICE. Second, the census is simple. The census takes about 10 minutes to complete, and it only asks 9 questions, including name, birth date and age, residence, sex, and race. I want to acknowledge here that some of these questions aren't simple. The census asks for sex and only has male and female as options. Also, the census asks for a residence, which for our unhoused neighbors is not a simple question. To clarify, you do not need to have an address to participate in the census. If you don't have an address where you usually sleep most of the time, you can use the address of where you are sleeping that night. If you don't have an exact address, you can describe where you're staying and include the city and state in the address section. For example, you could put the name of a park or a street intersection. Finally, the census is confidential. The Census Bureau is bound by federal law to protect response information, and response data is used only for statistical purposes. There are a number of ways people experiencing homelessness can be counted: online, by phone, at a group quarter, at a transitory location, and through service-based enumeration. For many of us, these are new terms, and we'll go over each of them today. You can now complete the census form online at my2020census.gov. When completing the survey online, a census ID number will be requested. Folks who have a regular address are going to receive a census ID in the mail. If you do not have a census ID, no problem. Simply select the link under the login button that says, "If you do not have a census ID, click here." You'll also notice at the bottom of the screen that translations are available in 12 languages other than English. Many members of our community do not have regular access to a computer or internet. The census has planned for questionnaire assistance centers to be available with public computers at places such as shelters and libraries. Many questionnaire assistance centers are not currently available due to COVID-19 related closures. However, some essential service providers, such as medical clinics, are open. So we've included a link at the bottom of the slide that will take you to a map to find where a questionnaire assistance center might be available near you. Another way to participate in the census is by phone, and the phone lines are now open. Customer service representatives are available in 14 languages, and telephone display device is available as an option for people who are deaf or hard of hearing. Another way to get counted in the census is through a group quarter. Group quarters are places like hospitals, residential treatment centers, nursing facilities, group homes, inpatient hospice, jails and prisons, and detention centers. Group quarters have several options for responding to the census. With e-response, an administrator at the facility fills in a template with data about each person staying at that facility on census day and electronically sends that data to the census. With paper response data collection, it's the same process as e-response but on paper. An administrator provides a paper listing of census response data for each person staying at the facility on census day and submits it to the census. For both of these options, individuals staying at the facility on census day do not have to themselves do anything. It's all handled by an administrator. Conversely, with drop-off pickup, a census worker drops off individual census questionnaires that then get filled out by every person staying at that facility on census day. And then the census worker comes to pick up the stack of individual questionnaires when they're completed. I'll skip to the end briefly. With facility self-enumeration, a census worker swears in and trains someone at the group quarter on how to conduct a census count and confidentially handle the data. The last enumeration method that's been planned for is in-person interviews. It's to be determined at this time whether those will continue. At this time, Census is encouraging count methods that minimize in-person contact. As we mentioned at the outset, this webinar is being recorded on March 26th, and these dates or how group quarter residents are counted may change. We've included the relevant group quarters website at the bottom of this slide for reference for any updates. Another way to participate in the census is to be counted through residence at a transitory location. Transitory locations are places like RV parks, hotels and motels, campgrounds, marinas, racetracks, or circus grounds. With the advent of COVID-19, the state and local governments are working to negotiate leases and occupancy agreements with hotels and motels to provide shelter and isolation as needed. So we are anticipating seeing an increase in taking residents there, at least over the next couple of months. The current enumeration plan is that census takers will visit each transitory location at a scheduled time between April 23rd and May 18th, 2020 to conduct in-person interviews with individuals. However, this may change. So again, we've included the relevant website at the bottom of the slide for reference for updates. The final option for participating in the census is through service-based enumeration. This provides an opportunity for people experiencing homelessness to be counted at a place where they receive services or at an outdoor location such as an encampment. Service-based locations include emergency and transitional shelters that have sleeping facilities, soup kitchens, mobile food vans, and mobile hygiene stations, and targeted non-sheltered outdoor locations where people experiencing homelessness live. By that term, we mean encampments, parks, bus stops, under highways, or along creek beds, for example. On March 18th, the census announced that service-based enumeration would be delayed 1 month to April 29th, April 30th, and May 1st. At this time, available enumeration methods for service-based locations are the same as those available to group quarters, namely e-response, paper response data collection, drop-off pickup, or in-person interviews. However, again, these dates or the ways in which folks are counted may change. So we've included the relevant website again at the bottom of the slide for reference for updates. So how can you help? As trusted members of your community, you have a key role to increase census participation, especially among vulnerable populations such as people experiencing homelessness. The census is counting on you to educate your clients and patients that the census is here, the census is important, and the census is safe, simple, and confidential. As we noted at the outset, we know that people have a lot going on right now, and census participation is not necessarily at the top of priorities. To encourage people experiencing homelessness to participate in service-based enumeration, Homebase is administering grant funding to nonprofit organizations to support purchasing incentives to participate in the census, such as socks, hygiene kits, and gift cards up to $5 an item. Applications are now being accepted, and grants will be awarded on a rolling basis for amounts between $500 and $5,000 until funds are exhausted. Interested nonprofit applicants should briefly describe a proposal for how to use the grant to provide participation incentives, the anticipated impact of providing incentives to increase census participation among individuals experiencing homelessness, the methodology that will be used to award incentives, and a proposed budget. Please email Homebase's census team at census2020@homebasecc.org for an application or any questions. We would be remiss if we did not acknowledge, of course, the ongoing COVID-19 pandemic. The census has asked us to share that it has never been easier to respond on your own, whether online, over the phone, or by mail, all without having to meet a census taker. The census has now pushed back enumeration at service-based locations and transitory non-sheltered outdoor locations by 1 month to the end of April and beginning of May. However, as we noted earlier, these dates may change again. Census staff are working diligently with group quarters, including hospitals, shelters, and transitional living facilities to ensure that residents are counted. and Census staff are now in the process of contacting group quarters administrators that had previously requested an in-person visit to ask them to consider an e-response or drop-off pickup paper surveys to minimize in-person contact with Census staff. As we've noted, these updates are coming quickly and often changing, and so we've included for you a couple of websites to monitor updates on COVID-19. The U.S. Census Bureau and California Complete Count both have very dynamic websites that will keep you updated as necessary as time progresses. Thank you so much for your attention on this. As we mentioned at the outset, we'll save some time for questions at the very end. At this time, I'll hand it over to Nora.
Great. Thank you, Monica. Can everybody hear me all right? So I'm going to be talking about effective communication to ensure that folks experiencing homelessness are counted in the 2020 census. And we're going to start off by talking about how to communicate that census information. So how to communicate from a place of cultural humility and really being aware that people who are unhoused face discrimination and stigma in many settings. Then we're going to talk about what information needs to be communicated so folks have an understanding of the content of that information and how to make that information accessible to everyone. And throughout, we'll try to address ongoing concerns about COVID and prompt areas where you may want to check in with the census website, the census resources that Monica referenced, to make sure that the information you are providing is up to date. So I'm going to start talking about the effective communication piece, and I want to talk about two concepts that folks are maybe familiar with and how those can be utilized in improving communication to consumers who are experiencing homelessness. So those two concepts are cultural competence and cultural humility. And there are several definitions out there, but I chose these two to really ground us in our conversation today. So cultural competence in healthcare describes the ability of systems to provide care to patients with diverse values, beliefs, and behaviors, including tailoring delivery to meet patients' social, cultural, and linguistic needs. Whereas cultural humility involves increasing self-awareness of your own biases and perceptions and engaging in a lifelong self-reflection process about how to put those aside and learn from clients. So I think one core difference between these two concepts is that cultural competency is more focused on learning and understanding a wide variety of beliefs and behaviors and cultural practices, while humility really involves reflecting on your own biases and beliefs and using that as a tool to remain open and receptive in communication with other folks. So why is this important? These concepts are important in communicating with folks who are experiencing homelessness for many reasons. I think first off, when culture is ignored, the people being served are at risk of not getting the support they need or actually receiving assistance or information that's harmful to them. Folks who are unhoused have a history of experiencing stigma and discrimination in many settings, so that's something to really be aware of. And vulnerable populations, including folks with disabilities, people of color, and people who identify as LGBTQI+, are overrepresented among the unhoused population in the U.S. So insensitivity to cultural heritage, native language, consumer beliefs and values, and to the special need of people who are unhoused often present really serious obstacles to healthcare and the dissemination of information, like census information. So one reason that we're going to have more of a focus on talking about cultural humility as a tool today is that people who are unhoused come from a variety of different backgrounds and have a diverse array of cultural practices. So while it's really important for healthcare providers to develop cultural competency skills across the board, you may not always have the tools or understanding to fully attune to someone's cultural experience or their background. So I think that's where cultural humility can be a very effective tool because it asks providers to adjust their communication style by using active listening, examining their own biases, and setting those aside in interactions with clients. So let's take a little bit of a deeper dive into cultural humility. Cultural humility is a lifelong process of self-reflection and self-critique whereby the individual not only learns about another's culture, but one starts with an examination of their own beliefs and cultural identities. So humility in this particular sense is having a sense that your own knowledge, right, is limited as to another person's culture. And we're limited because we have unconscious stereotypes of others, and we tend to default to those stereotypes or use them as a safety net to help explain behavior. So cultural humility can't be classed into a class or educational offering, but it's really an ongoing personal process. And that process involves looking at personal values, beliefs, and biases that are derived from your own culture and thinking about that, how that frames how you see the world. So how can we kick off or continue that process? So in order to begin that process of self-examination, you can review and consider your own experiences that inform internal biases and how you see the world and how you see other people. So that self-examination process can begin by exploring some of the things that we've put on this slide. So your family experiences and values, your peer influences, your relationships with other people, where you grew up, what neighborhood you live and work in, who you deal with on a day-to-day basis and how you define community, as well as your professional role and the culture of your profession. So reflecting on these things for yourself and seeing how your own experiences and your own culture may inform ideas you have about people who are unhoused or experiencing homelessness will be really key in sort of grounding your communication. And going into a conversation with a client, really making sure that your own biases and assumptions are not put onto the folks that you're serving. I think with particular regard to the census, we may make assumptions that can prevent people from being counted, right? So for example, assuming that someone will have access to a phone or to a computer, saying things like, you know, oh, this is an easy process, it should be no problem for you to complete, it's very quick and easy. You know, while it's extremely important that folks who are experiencing homelessness are counted, it's not always an easy lift for people. And so I think being sensitive to that and being aware of that reality is important in grounding your communication. There's so many different reasons why people become unhoused, and I think assuming that you understand, unless you have had that direct experience yourself, is often not an effective way to build rapport with someone. I think a better way to move forward is remaining open, listening to people's experiences, not making assumptions, and if you make a mistake and you make an assumption that offends somebody, really apologizing as opposed to getting defensive, because I think that's a very human thing. When we make a mistake or make an assumption that's incorrect, we often get defensive. And I think apologizing and acknowledging your mistakes so you can continue the dialogue and continue to connect with folks tends to be a better way to move forward. So that's really just a very, very brief introduction to those concepts and what that might look like, what that process of self-examination can begin to look like, hopefully for you. But just some quick takeaways. Being really mindful of your own stereotypes, biases, or assumptions, and considering how these assumptions may be informed by your own experiences and your own biases is important. Practicing active listening as opposed to making assumptions, considering an individual's living situation when communicating and making recommendations to them, and when appropriate, inquiring about it in a way that's sensitive and appropriate. So do not make comments that assume you know or understand why a person is unhoused, and don't assume the experience of one individual experiencing a form of homelessness will be the same as the next person. So we really don't have a lot of time today, and we understand this is an incredibly challenging time, especially for healthcare providers. But we just wanted to put these concepts on your radar and hopefully prompt that self-reflection process or a continuation of that process in your work. However, down the road, hopefully when you get a chance to breathe a little bit, we would encourage you to explore these topics more in depth, and hopefully that will help you better connect and serve patients, especially those who are experiencing homelessness. So here's some resources that will hopefully help you to do that. I really highly recommend the National Healthcare for the Homeless Council resources. They're very comprehensive and tailored to this particular community. So now that we've discussed what information, or sort of an effective communication style, I want to talk a little bit about what information we actually want to communicate about the census. And actually, just to step back for a moment, everything that I just walked through vis-a-vis cultural competence and cultural humility, we have a handout that will be posted on the CPCA website that you can review, and Madeline, I think, will be able to send out some follow-up information about that. So now we're going to talk about what information is helpful to communicate to folks about the census. And I think a great place to start is telling folks, I want to make you aware of the upcoming census. Can I give you a few pieces of information about that? And if folks are open to having that conversation, you can give a brief overview of what the census is. So every 10 years, the census counts every single person in the United States to determine funding for important programs, including affordable housing, food assistance, programs and shelters, and other homeless services. It's very important, and I can't emphasize this enough, that in your communication with folks, you really emphasize that there aren't any questions about citizenship or immigration status, and that personal information is confidential. And really, really emphasizing that the census cannot share information with any government agency, including law enforcement and ICE. Folks who are unhoused and experiencing homelessness are so often asked for personal information, and they're often asked to give up that very private information in order to receive core services that they need. So we really want to be super clear that this information will never be used for anything other than research purposes and not shared with any law enforcement agency, etc. So then you can explain, I want to give you the information that you need to get counted. So if it's unclear whether the patient has housing or if they don't have housing, you can start out by saying, if you have housing, census information will be sent to your address. And then if you do not have housing, really emphasizing that there are still many ways to get counted. So a brief overview, we've actually created a handout as well that includes a script, the script that we're walking through on the slides that you can hopefully take with you into an interaction with a client, and that may help you prompt that conversation. And we've included both a brief description of how folks can get counted and then a more in-depth description that may be useful depending on how the conversation goes. So the brief description is, if you're staying in an emergency shelter, transitional housing, receiving services or meals at a mobile food van or soup kitchen, or you live in an encampment, census staff will be counting people staying or accessing services at these locations in late April and early May. And I also do want to flag, as Monica mentioned, that those dates may change, so it's important to stay on top of checking in with the census to see how that information may change in light of the spread of COVID-19. You can also mention that those locations may also give people surveys to fill out, which will be given to the census. Then I will go on to say that explain to folks that if census staff do not count you at one of these locations, there are other ways to get counted. So you can complete the census online or over the phone, and you can also, and we've included that information on this slide. You can go on to say that if folks don't have access to a computer or phone, they can complete the census at one of the questionnaire assistance centers or kiosks. And those questionnaire assistance centers are essentially, Monica touched on this a little bit, but they're locations where folks can go to complete the census. And at the centers, there will be census staff that can help folks they can answer questions, they provide special language services, essentially provide support around completing the survey. However, as of March 26th, when this presentation was recorded, all questionnaire assistance centers and kiosks are postponed until further notice. So continue to check in to see about developments around that. When they are open, you can find the questionnaire assistance center nearest to you, and we've included the web link. Monica reviewed that as well, but where you can find the nearest location to you so you can share that information with patients. So now we're going to talk a little bit about access. And actually, let me step back for one quick second. So we've created a few handouts that I've been mentioning, one on cultural competency and cultural humility, one that is a script that you can use in your interaction with clients, and a third that can be given to the client. So going back for a second, I think walking folks through the information that we just reviewed to make sure they have a sense of what the census is and how they can get counted, and then providing them with a consumer handout that we've created that will summarize all that information and give them the web links and the phone numbers that they will need. So we're going to talk now a little bit about access, starting out with language access. If folks are non-English speaking, we recommend that you leverage any translation services that you're using to convey the census information that we just reviewed. If applicable, if folks are non-English speaking, you can ensure that folks are aware of language access telephone lines in 14 different languages for folks completing the census over the phone. And we've included a link here as well as on the consumer handout for that information. Also be aware that the online census website and survey is available in multiple languages, and there's instructional videos in 46 languages on how to complete the census. So now we're going to talk a little bit about access for folks with disabilities. Folks with disabilities are it's a population that has historically been undercounted in prior census administrations, and so we really want to encourage you to go to the Disability Rights Education and Defense Fund website. They have an incredible Disability Census 2020 toolkit with a lot of great information. So I would definitely recommend, when you have a moment, reviewing that information. We also want folks to be aware that the online questionnaire conforms with the latest web accessibility guidelines, and the Census 2020 website is accessible for folks who are blind or low vision or require the use of assistive technology. For persons who are deaf or hard of hearing, there is a video in American Sign Language on how to complete the 2020 census online. And for folks who are deaf or hard of hearing, there's also an English TTD number for folks who want to complete the census over the phone. So we just wanted to close out with including some general tips that we reviewed today. So utilizing cultural humility tools in your communication with clients and really not making assumptions about their experience. Also, I would add continuing to build up cultural competency across your practice with special attention to folks who are experiencing homelessness. Making sure that you know what information to communicate and that communication is clear and accessible. And again, that will require staying on top of updates from the census related to COVID-19. Using the script that we've provided, as well as the consumer handout and supplemental information to support your communication with folks. And as I already mentioned, monitoring the census website for updates related to COVID-19. We can't emphasize that importance of that enough as things appear to be changing quite rapidly. So that's what we have for you today, but we understand, again, things are changing quickly and questions may come up for folks, and we really encourage you to please reach out to us if you have any questions, concerns, feedback. If you need additional resources, we are happy to provide those for you. Again, the handouts and flyers that I mentioned, we will be posting to the CPCA website where it will be accessible with this presentation. We will be updating the consumer handout to be available in several different languages as well down the road, and we will update those materials as things change related to the spread of COVID-19. Thank you, everyone who joined us today. Please feel free to reach out if you have any questions, concerns, or feedback about the presentation. We are happy to provide you with any resources that you might need that will help you connect with folks who are experiencing homelessness and encourage folks to participate in the census. You can reach out to us at our email at census2020@homebasecccc.org. Thank you so much for your time.